Hello, I'm Dr. Anupama from Shreshtha Ayurvedic Center, Koramangala, Bangalore. On the occasion of the 25th anniversary of Shreshtha Ayurvedic Center, we invited questions about Ayurveda from all of you. We are grateful for the overwhelming response and we promise to respond to your questions as much as possible. As the first question in this series, I would like to attempt to answer this question, which is most often asked by you all. The question is why following pathya or diet advice is necessary. Pathya is one factor probably considered the most difficult part of taking Ayurvedic treatment. We have patients who are very regular in taking the medicines but not so enthusiastic about following the pathya or diet advice. I thought knowing the reasons why pathya is not just necessary but also extremely important will convince you all to follow it better. The word pathya means the regimen, which is hita, meaning good, wholesome, or suitable. Ayurveda emphasizes how food is responsible for both health and disease. So, if a certain kind of food is one of the reasons for your disease, it only makes sense for us to stop taking that food. So, your doctor's diet advice will ask you to avoid that food and similar food groups which can worsen the disease. The second reason is while your body is healing, it will do a better and faster job if it's not burdened by heavy and hard to digest foods. Therefore, your pathya list will ask you to avoid such heavy and dense food and recommend light and easy to digest food. Sometimes, in chronic or recurring conditions, your doctor may ask you to eliminate certain food groups for 4 to 6 weeks to identify your food intolerances, for example, dairy or wheat products. In this duration, we are giving time to the body to flush it out and then observe if it gives us a breakthrough in the treatment. This kind of exploration is very useful in chronic inflammatory conditions, skin diseases, etc. And another question most often asked by patients is if the pathya should be followed permanently. Mostly not, except for diseases like diabetes. Let me share a trick. Follow the pathya advised by your doctor as strictly as possible in the beginning when you start the treatment, which will help quicker healing, which means your doctor can start relaxing the pathya sooner. Once you're healed, your doctor will advise you with healthy alternatives which will ensure long term health. And if you're concerned about any nutritional deficiencies like calcium or vitamins while on pathya, talk to your doctor for solutions. As you can see, pathya or diet advice prescribed by your doctor should not be considered casually and should be understood as an integral part of your treatment. Hope this information is useful to you in your journey towards healthy and disease-free life. Keep your questions coming. We will try our best to reply. The WhatsApp number and email ID to send the questions is given in the description box below. Thank you.